Lost in translation. Tips for communicating with a person with dementia. Communicating with a person with dementia can be a challenging and frustrating experience. As the condition progresses, daily tasks such as speaking and understanding become more difficult for the person affected, which can lead to misunderstandings, anxiety, and confusion. As a caregiver or family member, it's important to remember that the person with dementia is not intentionally trying to confuse you. Instead, they are struggling to understand what is happening around them. In this blog post, we will be discussing some tips and strategies that can help you communicate more effectively with a person with dementia. From using simple language and non-verbal cues to being patient and staying positive, we will provide you with the tools you need to connect with your loved one and make their day-to-day life a little easier. 1. Introduction to dementia and communication difficulties. Dementia is a term used to describe a set of symptoms associated with the decline in memory or other cognitive skills that are critical enough to impact a person's ability to perform everyday activities. Dementia can also impact a person's ability to communicate effectively with others. As the condition progresses, individuals with dementia may find it increasingly difficult to express their thoughts and emotions in a way that others can understand. This can lead to frustration and confusion, both for the person with dementia and the people around them. It's important to understand that communication difficulties are a common aspect of dementia, and that there are strategies that can help to overcome these challenges. By learning more about dementia and how it affects communication, you can develop a better understanding of how to communicate with a person with dementia in a way that is effective and respectful. In this article, we'll explore some tips and techniques for communicating with a person with dementia, and explain why these strategies can be so effective in fostering positive interactions and relationships. 2. Understanding the effects of dementia on communication. Dementia is a progressive neurological disorder that affects a person's cognitive abilities, including their communication skills. As the disease progresses, it can become increasingly difficult for individuals with dementia to express themselves verbally or understand what others are saying to them. They may struggle to find the right words, repeat themselves frequently, or lose track of the conversation. They may also have difficulty processing information, following instructions, or remembering recent events. It's important to understand these effects of dementia on communication in order to communicate effectively with someone who has the disease. This means being patient and taking the time to listen and understand what they are trying to say, even if it takes a bit longer. Nonverbal communication can also be helpful in communicating with someone with dementia. This includes using gestures, facial expressions, and touch to convey meaning and show empathy. It's important to remember that communication is a two-way street, and both parties need to be willing to work together to ensure that their message is understood. By taking the time to understand the effects of dementia on communication and adapting your communication style accordingly, you can help to make interactions with a person with dementia more meaningful and fulfilling. 3. Barriers to communication and how to overcome them. Communication with a person with dementia can be challenging due to the barriers that exist between the caregiver and the person living with dementia. These barriers can include difficulties with memory, language, and comprehension. Here are some tips to help you overcome these barriers. 1. Use simple language. When you communicate with someone with dementia, it is important to use simple and concise language. Avoid using complex vocabulary or long sentences that may be difficult for them to understand. 2. Speak slowly and clearly. Speak slowly and clearly, giving the person time to process what you are saying. It is also helpful to speak in a calm and reassuring tone, as this can help reduce any anxiety or confusion they may be feeling. 3. Use visual aids. Visual aids, such as pictures or diagrams, can be helpful in communicating with someone with dementia. They can help to reinforce your message and make it easier for them to understand. 4. Avoid distractions. Try to communicate with the person in a quiet and calm environment, free from distractions. This can help them to focus on what you are saying and reduce any confusion or disorientation. 5. Be patient and understanding. Finally, it is important to be patient and understanding when communicating with someone with dementia. Remember that they may struggle to express themselves or understand what you are saying, but with time and patience, you can find ways to communicate effectively. 4. Tips for effective communication with a person with dementia. Communicating with a person with dementia can be challenging, but there are ways to make it easier for both of you. Here are some tips for effective communication. 1. Speak clearly and respectfully. Speak in a calm, clear voice and use respectful language. Don't talk down to the person or use baby talk. 2. Get their attention. Make sure you have their attention before you start speaking to them. You can do this by using their name or gently touching their arm. 3. Use nonverbal cues. Nonverbal cues like facial expressions and body language can help convey your message. Use eye contact and smile to show that you are engaged in the conversation. 4. Simplify your language. Use simple words and short sentences to make it easier for the person to understand you. Avoid using complex sentences or technical jargon. 5. Avoid distractions. Try to avoid noisy or busy environments that can be distracting. Turn off the TV or radio and close doors to minimize distractions. 6. Give them time. Allow the person with dementia to take their time to process what you are saying. Be patient and don't rush them. 7. Use visual aids. Using visual aids like pictures or written notes can help the person understand what you are saying. Effective communication is essential for building a relationship with a person with dementia. By following these tips, you can make communication easier and more meaningful for both of you. 5. Using nonverbal communication cues. Nonverbal communication cues can be extremely helpful when communicating with someone with dementia. This is because dementia can affect a person's ability to understand and process language. Using nonverbal communication can help you get your message across more effectively. One way to use nonverbal communication is by using gestures. For example, if you want to indicate that it's time for the person to eat, you can point to the kitchen or make a motion of bringing a spoon to the mouth. Another way to use nonverbal communication is through facial expressions. If you want to show that you care, you can smile or nod in agreement. Body language can also be used to convey a message. If you want to show that you are listening, you can lean in and maintain eye contact. If you want to show that you are relaxed and approachable, you can uncross your arms and adopt an open posture. It's important to remember that nonverbal communication should always be used in conjunction with verbal communication. Using both together can help ensure that your message is clear and easily understood. Additionally, it's important to be patient and understanding when communicating with someone with dementia. They may need more time to process what you are saying or may become frustrated if they are having difficulty understanding. By using nonverbal communication and being patient, you can help ensure a more effective and positive conversation. 6. Using simple language and short sentences. When communicating with a person with dementia, it's important to remember that their cognitive abilities may have declined, making it difficult for them to process complex information. That's why it's essential to use simple language and short sentences when speaking to them. Avoid using jargon, technical terms, or complicated words that might cause confusion. Instead, use easy-to-understand words and phrases. For example, instead of saying, "We need to go to the hospital to see the doctor," try saying, "We're going to see the doctor to make sure you're feeling okay." It's also helpful to break down complex tasks or instructions into smaller, more manageable ones. For example, instead of saying, "Get dressed and brush your teeth," try breaking it down into 2 steps. Put on your shirt and pants first, and then brush your teeth. Remember to speak slowly and clearly, and allow the person with dementia enough time to process what you're saying. Using simple language and short sentences can make a significant difference in helping the person with dementia understand and communicate effectively. 7. Avoiding distractions and noisy environments. When communicating with a person with dementia, it's crucial to ensure that the environment is calm and quiet to avoid any distractions. People with dementia often have trouble focusing and processing information, so a noisy or busy environment can make it even more difficult for them to understand what's being said to them. If possible, find a quiet and comfortable place to talk, away from any loud noises or distractions. Turning off the TV or radio can also help minimize background noise and make communication easier. It's also important to avoid multitasking or being distracted yourself while communicating with a person with dementia. Giving them your full attention can help them feel more comfortable and understood, and may also help prevent any miscommunications or misunderstandings. By creating a calm and quiet environment, you can help ensure that your communication with a person with dementia is as clear and effective as possible. 8. Listening actively. One of the most important things you can do when communicating with a person with dementia is to listen actively. This means paying close attention to what the person is saying and responding in a way that shows you understand them. Active listening involves giving the person your full attention and avoiding distractions such as your phone or TV. You should also try to maintain eye contact and use body language that shows you are engaged in the conversation. It's important to remember that communication with a person with dementia may take longer than usual. They may struggle to find the right words or remember details, so it's important to be patient and give them time to express themselves. You should also avoid finishing their sentences or interrupting them, as this can be frustrating and cause them to lose their train of thought. When responding to the person, try to use simple, clear language and avoid using jargon or complicated terms. You should also repeat key points and ask clarifying questions to make sure you understand what they are saying. By listening actively and responding in a way that shows you understand, you can help to make communication with a person with dementia easier and more effective. This can help to reduce frustration and improve their overall quality of life. 9. Providing visual aids and prompts. Providing visual aids and prompts is a great way to improve communication with someone who has dementia. Visual aids can help them recall certain things and understand better what is being communicated to them. For example, you could create a memory box with items that are familiar to them, such as old photographs, a favorite book, or a piece of clothing. This can help trigger memories and stimulate conversation. Another helpful visual aid is a picture board with images and words that relate to common daily activities, such as eating, dressing, and bathing. This can help the person with dementia remember what needs to be done and in what order. You can also label items around the house, such as chairs, tables, and doors, to make them easier to recognize. Using prompts can also be helpful in communication. For example, if you want the person to take their medication, you could place the medication in a visible location and leave a note or reminder nearby. You could also use a clock or timer to remind the person of important tasks or appointments. Visual aids and prompts should be tailored to the individual's needs and preferences. It's important to involve the person with dementia in the design and use of these aids to ensure that they are effective and meaningful. By providing visual aids and prompts, you can help improve communication and enhance the person's quality of life. 10. Being patient and showing empathy. When communicating with a person with dementia, it's important to remember that their thoughts and emotions may not always be clear to you. This is why it's crucial to be patient and show empathy. It's important to remember that the person with dementia may be feeling frustrated, scared, or confused, and it's not their fault. Take time to listen to what they have to say, and don't rush them. Speak clearly, calmly, and slowly. Use simple language and short sentences. Avoid using complicated words or phrases. If they don't understand what you're saying, rephrase it in a simpler way. It's also important to show empathy. Put yourself in their shoes and try to understand what they're going through. Be kind, smile, and use positive body language, such as nodding your head or holding their hand. Try to make them feel comfortable and safe. Remember, communicating with a person with dementia can be challenging, but being patient and showing empathy can go a long way in building a strong and positive relationship with them. It's important to remember that they're still the same person you've always known, they just need a little extra care and understanding. 11. Supporting family and caregivers in communication efforts. When communicating with a person with dementia, it's not just the patient who needs support. Family members and caregivers can feel lost and frustrated in their efforts to communicate effectively. It's important to offer support to them as well. One way to support family and caregivers is to provide education about dementia and communication techniques. This can be done through training sessions, support groups, or one-on-one consultations. By providing education and resources, family members and caregivers can feel more confident in their ability to communicate effectively with their loved one. Another way to support family and caregivers is to encourage self-care. Caring for someone with dementia can be emotionally and physically draining, and it's important for caregivers to take care of themselves as well. This can include taking breaks, seeking support from others, and engaging in activities that bring them joy. Lastly, it's important to create a support system for family members and caregivers. This can include connecting them with other caregivers who are going through similar experiences, providing access to mental health professionals, and offering respite care services. By creating a supportive environment, family members and caregivers can feel more equipped to handle the challenges of communicating with a person with dementia. 12. Conclusion and resources for further support. In conclusion, communicating with a person with dementia can be a challenging task, but it's important to remember that they are still the same person they always were, and they deserve to be treated with kindness and respect. With a little patience, understanding, and the right approach, you can build meaningful connections and make their day-to-day life more enjoyable. Remember to use simple language, avoid distractions, and make eye contact when speaking with them. You can also use nonverbal cues, such as facial expressions and gestures, to help get your message across. If you're looking for further guidance and support, there are many resources available to help you in your journey. The Alzheimer's Society, for example, offers a wealth of information and advice for people living with dementia and their caregivers. You can also find local support groups and connect with other caregivers who are going through similar experiences. At the end of the day, the most important thing is to approach communication with empathy and understanding. With a little patience and compassion, you can make a positive difference in the life of someone with dementia. We hope you found our article helpful in understanding how to communicate with a person with dementia. It can be a difficult and frustrating experience for both the person with dementia and their loved ones. However, with patience and the tips provided in our post, you can make the communication process smoother and more effective. Remember, even though the person may not remember what you said, they will remember the positive feelings you leave behind. So, make sure to communicate with love, respect, and understanding.